Thanks, guys, for coming to our Discover Smile Project webinar. My first one. I've never done this before. This is very exciting. So please be patient with me. Thank you. You've been invited because you're a part of a chiropractic community that is so dear to my heart. You are somehow affiliated with chiropractors. Either you know us, you are a patient, you're related to us, or you're employed by the chiropractic industry. So thank you so much for being here and letting us talk about this industry on this project that we are launching. We are going to talk about this Smile Initiative. It's our second vision event. We did a vision dinner in March, and I want to let you know what we've accomplished in the last couple of months, and we're going to outline our discussion. Phil's going to be able to, Phil is shown as a QR code right there, but he's going to be helping me with the tech. So if I run into a snag, he's going to help me out. Dr. Buddy is right here next to me. So he and I are the co-founders of this, co-founders of the Smile Project, and is a nonprofit initiative empowering chiropractors, protecting healthcare, particularly in Northeast Ohio. As healthcare is shifting away from being physician-run, we are building Smile Project to stand in that gap. We're going to talk about healthcare trends. We're going to talk about how chiropractors can help solve some of the downward spirals. Talk about Smile Project being a way to connect people, the right institutions. What's in it for you, and how can you help? Smile Project, Serving Man in Light of Eternity. It's a name that came to me during prayer time. It's been a number of years now. Dr. Buddy and I have had hiccups over the years as practicing chiropractors. And what Smile Project is it's accumulation of a bunch of different obstacles that we had in our professional life that we're going to solve for the next generation of chiropractors. We're going to leave a legacy with this. We're going to help healthcare in Northeast Ohio. We have some neat solutions that are very doable, how it's going to impact our Northeast Ohio community, and how we can leave a legacy. So healthcare is changing. Absolutely. There's no question about that. 25 years ago, people had access to a primary care physician. They had access to a medical doctor, a DO or a DC. And what's happened is that those big practices where they were patient focused and physician run, they've been purchased by the big hospital systems here in Cleveland. So the landscape of Cleveland is that is that as of last year, the last hospital has been gobbled up by one of the big four. So it's Cleveland Clinic, Metro, UH, and VA. And those are really your only choices in this area. There are a few people trying to do what we're doing and go out on their own, but they are few and far between. So people are having a lot of trouble having access to their physicians. They're being intercepted by administrators. They're being intercepted by nurses, and they're just not getting in to see their physicians. So a lot of the doctors sold their practices to the big four because they had hopes of being more patient focused, and they didn't have to do things like administration. They didn't have to do things like billing. They were looking forward to that. Unfortunately, what they found in exchange was the big business was just running metrics, and the metrics were running their care, and it wasn't as patient focused as they had hoped. And they don't get to choose their support staff, and it's a challenge, absolutely a challenge. So patients can't get in to see their physicians. I had a patient earlier this week. She and I talked a couple weeks ago about she has a varicose veins and she needs to talk to a vascular surgeon. She called them. She had a scare over the weekend, and the soonest she can get in is October, 4 months away. So I sent her the name of another physician that I know that specializes in that area. She just left me a message about an hour ago that she's able to get in next week. Very exciting. But we still helped her quarterback that access, because if she'd done it on her own, she'd be waiting till the fall. So what solutions do we have? So we need to protect personalized healthcare. We need to be patient focused, and we need to be physician run. So what is the solution? Chiropractors are the solution. Of course, chiropractors are the solution. I'm standing here talking to you, right? So chiropractors are the physician that has the specialty that fills this healthcare void the most. I'm very proud of our profession. We are 8% of the Ohio primary care physicians. We see 11% of the population. I think we're pretty efficient. That's pretty good. We are the safest form of healthcare and the most effective. We focus on health. So we're going to talk about a little bit about what makes medicine and chiropractic a little different. Medicine is the study of what makes man ill. Chiropractic is the study of what makes man well. When Dr. Buddy and I were in school, we were in Kansas City, and UMKC was right next door. It was the medical school, and we shared a lot of the professors. We shared a lot of the textbooks. We share a lot of the study space. We even had the similar exams, same exams. What the difference was once we had that root knowledge, what do you do with it and what question are you asking? The paradigm is very different. What makes man well versus what makes man ill. So, how is Smile Project going to help it? So, this is the chiropractic community. These are the people I'm speaking to today through the course of my 3 Zoom meetings. You guys are the patients, the family members, the administrators, and the people who are affiliated with the chiropractic schools. These are the people in the malpractice insurance. These are the support industry that helps hold chiropractic up. They're the people who sell us our face paper and our tables. This is the chiropractic community. This group is connected to the chiropractors. These are the practicing physicians. These are the ones out in practice, hands-on, doing the work every day, making a difference in people's lives, turning on their hope, giving people the tools they need to really reach their genetic potential. We're going to connect those to a third group of people. These are the collegiates. The collegiates are the 16 to 22-year-old students. These students have not yet decided to become chiropractors, but have a passion to serve and might be considering chiropractic. They might also be, let's say, a statistician who wants to be affiliated with research in chiropractic. Maybe they're a promotional person. Maybe they're much like Phil, who has an ATC training and also a specialty of tech, but he wants to support it. So we don't know who these collegiates are. We're going to need your help to help us figure those people out. Now, once those people are identified, we're going to talk to them. If they are a match for chiropractic school, we're going to send them off to chiropractic school. Our chiropractic schools are doing an amazing job. There are 16 chiropractic schools in this country. 10 of them we're going to be focusing on, and they do an excellent job. They've got the students for 4 years. They train them very well. They pass their boards, and then they come back to us. And now they're going to work in the field doctors' practices. Those young practitioners are going to learn from the experienced doctors. Those young practitioners are going to hone this experienced doctor's skills as well. Make sure that you always learn more when you teach, right? And iron sharpens iron. So then we have less burnout and more effective outcomes for patients. And as a result, all of these connections are run through Smile Project. Again, serving man in light of eternity, empowering chiropractors, protecting healthcare. So what are the benefits of Smile Project? So the benefits of Smile Project is we're going to increase the number of doctors in the area. We're going to increase it by 10% over the next 10 years. We are going to increase access to the family doctor. Sometimes patients have to wait a day or two to get in to see us. We would prefer that they could get in as quickly as they needed to. Unlike the medical profession where now people are scheduling 4 months, 6 months out. I hear that every single day. We're going to focus on education. We're going to focus on research and focus on charity, scholarships within our practices, specialties. Our particular office focuses on military families and families in need. Every practice that's affiliated with the Smile Project is going to have some sort of scholarship. They might write their scholarships a little differently. Let's say they might work with a population that is recovering alcoholics or people who have been sex trafficked. So whatever it is at-risk community that they are choosing to serve at a discounted rate. We're going to partner also with the chiropractic schools. So we have field research. The chiropractic schools all have a department of research. They will need field practitioners to gather some of the data. They can then write it. We can also use some of the undergrads to help us write some of that. We're going to work on community education as well. Chiropractic care. Why is it that we're the right profession to be filling this void? So everyone agrees the void is there. Why is it chiropractors are the ones that should be filling this void? I'm going to tell you a couple stories. So let's tell you about 2 gals walk into the office. They're both holding their elbow and they're crying. Oh my goodness. Okay. If Kathy walks into the office, she's going to be sent back to a room. I'm going to talk to her. We're going to find out what's going on. Now, Kathy cries at every visit. She just needs a place to decompress. She has a really stressful home life. She comes to the chiropractor's office. She cries every time. If she's holding her elbow, I'm not going to stress about it until she tells me a really dramatic story like she fell on the ice or something. Now, Terry comes in. Terry's tough. Terry never cries. If Terry's crying at my front desk, I am walking with her immediately back to the back room. We're taking x-rays immediately. I know something's wrong. So I have that advantage that an emergency room doctor doesn't have. One, I don't have to go over the whole history and repeat it ad nauseum before I can start treating. One. Two, I know their family. I know their background. I know what's happening in their life. I can help them get the care they need. very efficient. So why chiropractors also can offer the non-pharmacological options. We want to give people options before drugs and surgery are required. So let's say I have a patient who has been dealing with lifetime migraines and she's been managing with pharmaceuticals, but now she wants to get pregnant. She knows those medications are very toxic for her newborn baby or for her unborn baby, and she wants another solution. So she's going to manage her migraines with chiropractic. Very exciting cases like that. You can see some other examples on there. One of the things patients tell me is, let's say somebody says, oh, I just discovered I have non-alcoholic fatty liver, and my doctor says, diet and exercise, I'll see you in 3 months. Ah, that completely paralyzes patients. That makes them hopeless, that makes them inactive, it makes them apathetic, and now they're completely paralyzed and have nowhere to go. So they come and talk to us. We can say things like, okay, so what are you doing? What do you think you're doing right? What do you know you can improve? So sometimes they say, I'm doing all the things right. I'm doing it all right. I'm having diet food. I'm having Diet Coke. I am doing all the things right. Well, sometimes what they think is right and what's right for them might not be the same. Sometimes it's as simple as needing more water, but we can really drill down and find that solution for them. So sometimes patients will go onto Dr. Google, and boy, is that an overload of information. And how do they know what's nonsense and what's for real? They come in and they ask us. Then we also have chiropractic is community based. There's only a few hundred feet between where their car is and where they need to get in to see us. So it's very accessible, and we don't need hospitals to tell us that we can or can't practice. Here's a neat study. Over the course of the last 15, 20 years, this research study has been reproduced a couple of times. People who utilize chiropractic 7 years or more and use chiropractors as their primary care physician have these amazing outcomes. Fewer hospitalizations, notably fewer surgeries, and way fewer pharmaceutical costs. There's a lot of people who've tried to reproduce this study. Some have tried to debunk it, some have tried to prove it right, and they all come back to about the same research. Boy, isn't this neat. So there are solutions out there. It's not just drugs or surgery. Again, Smile Project is going to connect community to physicians in the field, to the collegiates that need to be up and coming. Right now, the chiropractors in the field on average are 55 years old. That means that they're going to be aging up and aging out. We need to refill the coffers so that there is a profession to hand down, and the next generation has access to this amazing care that we are so grateful to be able to utilize. And then we will grow the chiropractors in the area. So what does the community get out of this? So they get more personalized care in Northeast Ohio. Our young, talented academics who want to serve will leave to go to chiropractic school and come back to Cleveland. Right now, Dr. Buddy and I a couple of years ago went over to Cleveland Chiropractic College, which is located in Kansas City, and we were talking to these young students. Boy, we would have hired 3 or 4 of them, but they were all going back to their hometowns. So we realized that we had to go before the chiropractic schools and start looking at them in high school and in college, talking to the prep schools, talking to the pre-science programs. We also need to have a way to entice these doctors back to Cleveland. Of the last 4 doctors that we have sent off to chiropractic school, only one of them is coming home. One has met a husband in Atlanta and has gotten married and staying in Atlanta. Another one met a wife in Kansas City and he is staying in Kansas City. Another one, she and her husband wanted to move to Florida. How can we compete with beaches? So the way we can compete is by helping them manage their finances and help them manage with job opportunities and manage their student loans. What is the right course of action? Student loans are very daunting. There's so many different things and so many people will give you information. But if you have a structured strategy, student loans can absolutely be managed and not be the albatross that they were for other people who didn't have any education on it. The community has more chiropractors and Clevelanders will have more care. How do the chiropractors benefit from this? Now, these chiropractors in the field, they're the ones who are going to be shouldering the brunt of the financial burden of this project. So they're going to be paying for the young doctors to come work in their practices, either full-time or part-time, whichever it is they want and whichever they prefer and can afford. We're going to have iron sharpening iron. Doctors are going to have the opportunity to influence the next generation. And we're going to have more community, streamline our marketing efforts, and increase our operations and our continuing education, as well as improve our technology. Collegiates. What are these undergrads and high school students going to get out of this? They're going to have opportunities for research. They're going to have opportunities to learn about what their potential future options are. So I had an email just this week from my alma mater. My alma mater is Bucknell University. It's out of Pennsylvania. And they are sending out invitations to field, for, in my case, practitioners, but anyone who's in industry, and to do some research. And they're going to pay these kids to do research in our office. How great. They said, we just need some ideas. Okay, we've got some ideas for you. So if you have some ideas as to what these undergraduate students can be studying over the course of this summer, please let me know as well. I certainly have some ideas. They're going to have a chance to talk and shadow physicians and see which professional direction they want to go. I hate to see students leave undergrad and then go and say, I absolutely want to be a dentist. No two ways about it, but they haven't shadowed veterinarians, they haven't shadowed chiropractors, they haven't shadowed medical doctors, anything, but they need to know what that feels like. And this is the opportunity for them. So since you're going to help me find and identify the next generation of chiropractors, what is it that makes a chiropractor good? Obviously, the chiropractor has to have excellent grades. They have to be willing to work hard. There is no free pass on this. There's no easy way. There's no free way to do this. You do have to be willing to work hard. They have to have good grades. They have to have a high ethic. They have to prioritize the material that the schools are presenting. The chiropractic school only has 4 years to teach you what it takes to be a chiropractor. Boy, they give you so much good information, and you have to master all of it. There's a little here and there that's fluff, but most of it you need. It's not like elementary school where you could just pass something by. You also have to be coordinated. Most chiropractors are either artists or athletes because we have excellent eye-hand coordination. You have to be willing to be a lifetime learner. What that means is you're willing to spend your own money, your own time, and go out into the field. So some people in corporate industry have they get time away from their job and they get paid by their employer to go get trained. It's not really how it works in our industry. We have to pay for it. We take our own time and we go learn what it takes so that we can take care of our patients the absolute best we can. And you have to be servant-minded. You've got to be other-focused. All right, the graphic again shows us community chiropractic collegiates joined together through SMILE project. How is this going to work with money? The revenue of this. Of course, any project like this is going to have a fiscal side. So the first 85% of the money is going to be shouldered by the affiliate doctors, the affiliate chiropractic offices. They're going to pay for the associate doctors to work in their office. Much like the doctors at the Cleveland Clinic are paid for by the Cleveland Clinic Foundation, same story. SMILE project of doctors are going to be paid for by the doctors they work for. Then the next 15% is infrastructure. And that's what we're working on now. That we are expecting to have $45,000 be our infrastructure expenditures over the course of each year. Now, that's going to be a decrease in percentage over the next couple of years because we're going to be adding grants. We're going to be adding donations from the industry. We're going to be adding publications. We're going to be adding research. These things will also help bolster that. So far, so we've been at this for not quite a year yet. We started in September of 2023. This is our second fundraising event. At the first fundraising event, our vision dinner, we raised nearly $15,000. I think that was a great success, and we're for the first quarter of the year. We still have more to go. So resource allocation. Once we have this $45,000 that we're looking to accumulate, what are we going to do with it? We are going to have community education programs. That's going to take manpower, not money. We're going to have the associates' wages. That's going to take up 76% of this budget. That's the biggest bulk. We're going to have part-time administrative staff. We already have 2. We have Phil, who you met earlier in the meeting. He's helping us with technology. And Sam she's the one you've been emailing back and forth with. She is in charge of communications. Thank you so much for the 2 of them, their hard work already. We're purchasing the website, the software, the CRM, the professional tools, and the professional fees. So we hired an attorney and we've hired an accountant, and they are doing a super job already. We do need to purchase swag. If any of you have any suggestions as to what the 16 to 22-year-olds would like for swag, which is the giveaways, please let me know what you think that would be. Emergency fund, just good responsibility, a little buffer. Professional development, we're going to be training each other, and that will be, again, manpower, not money. Board of directors, we have invited 3 more people to be part of our currently 4-person board of directors. We'll be swearing them in at the next meeting, which will be early next month. And so that's where we're doing, and we've been busy. So very excited to share with you what we've accomplished so far. We've already gotten the CRM, which is the contact relationship management software. We're utilizing GiveButter. Phil is going to tell you a little bit more about GiveButter. We're excited about it. It builds community. It helps people, donors, talk to each other so this chiropractic community can bond and create relationships. We're doing friend raisers, even more than fundraisers. We've ratified our bylaws already. We're pretty excited about that. We've purchased and trained on Zoom. So you can see we're using that today. We've invited 3 people to be on our board. We've hired a CPA. We've bought QuickBooks. We completed our 990. Our 990 just tells you that the reason I listed that, it was extremely simple, but it just tells you that we are already making sure that we are following all federal guidelines, all state guidelines. We are following all of the rules. We've communicated with 2 of the 10 chiropractic schools. Dr. Buddy and I will be going down to Kentucky next month. We have an invitation to go meet with the vice president and the clinicians at Campbellsville University, which is down in Kentucky, just south of Lexington. They will be graduating their first class at the end of this year. Super excited to meet them and learn what their philosophy is. And if we like what they're talking about, then we will get on board with them. We have gotten quite a bit of support from Cleveland Chiropractic College, which is where Dr. Buddy and I graduated. It happens to be located in Kansas City, not Cleveland, Ohio. And we published our first rendition of the website, which took a lot more work than we had anticipated. So we're absolutely writing that down. All right. Oh, come on. There we go. In summary, healthcare system is a mess. We can offer hope. Smile Project offers a solution in Northeast Ohio. And how can you make an impact for the next generation? So here's how you can help us participate. We're going to ask for one of 3 things: tithing, talent, or time. And if you can offer any of those, I would so be grateful. We're going to, of course, everything needs money to run on. Phil's going to help you talk about how to do that. Like to share your ideas, your expertise. If you have an area of expertise in marketing, if you have an expertise in legal, if you have ideas, if this has sparked some ideas, it's things you'd like us working on, we would really like to hear from you. Luckily, after the last 2 webinars, we've gotten phone calls personally and then emails through our website of people giving us ideas. Over the dinner, we got lots of great ideas. Most of them were where we could serve more, and absolutely we would love to serve in the nursing homes, in the jails, in the sober homes, 100%, but we need more manpower. Absolutely. You can sign up for our website and pray. We absolutely need divine intervention to continue our impact and prayer, and so we can serve man in light of eternity. So our future vision, we're going to be adding more practices. We're going to be talking to the new school in Puerto Rico. There's a new school coming up in Pittsburgh. We're going to talk to the schools in upstate New York, and we're going to be working on securing grants and research. So I'm going to turn it back over to Phil, and if you'll help me out with talking about GiveButter.
Dr. Jen, thank you so much. Great presentation. So ways that you can engage. Our website is smileprojectinc.org. And on there, we are able to, we have a donate button that'll take you through the donation process. We also have our QR code up on the screen, and we can also do text to donate. This event, we're doing Discover Smile. Text that to 53555, and you will get a text back with the link to go ahead and donate. We really like GiveButter. They work with nonprofits. There is no fee for us to use the platform. They do ask for a tip from our donors. This is an optional step that you guys can zero out if you do not feel they have earned your donation. I put a few links in our chat room. We have we have our Smile Project website, the GiveButter event that we are currently in now, and then also the text chain.
So we're really excited to have this GiveButter connect with our website. That was a new thing that happened this week. Yay, we were hoping it would happen before this event. And the GiveButter is going to be, so when we have the affiliate doctors or the Smile doctors in the affiliate practices, the doctors will be expected to help do some of this fundraising and we'll be doing a little friendly keep banter between the two, and we'll be fundraising from those different practices. And Give Butter has a Facebook feel so that people can communicate with each other and connect through friend raising as well as fundraising. Really excited for him. They've got a very new, hip, young vibe. I like that. Let me tell you a little bit about our website. It's smileprojectinc.org. It is not the Smile Project, and it is also not Smile Train. Those are two other charities, Smile Project Inc. And you've seen our color scheme through this presentation. You can look for that color scheme and you will be able to identify the right one. So far, thank you very much for my family for putting up with my many, many renditions of this project. So Porter and CJ, thank you so much. We also have brought on Sam as our Director of Communications and Phil as our Director of Technology. We have the 3 other board members that are coming on soon as of next month. And we have room for a couple more team members on the board of directors. If you guys know someone or would be interested yourself to be on this board of directors, we would love to talk to you about what that's going to entail. Anybody have any questions for me? All right.
Yeah,
Oh,
I
go
had a
ahead.
question. So, what exactly is Give Butter, and does the community use it?
Bill, do you want
I
to field
will.
that?
Yep. Let me pull up the website. Okay, so Give Butter is our donation platform. It is a web service that helps us process our donations and also helps us get our message out to everyone. This is the Zoom exclusive event here. And as you can see, we have a nice little welcome video, information about the event, and part of our story. We also have our nice donation link up here, and that's going to take us through a standard donation process through a secured server. As we continue through the donation process, we're able to put our name and our message out on our public board to give words of encouragement, to give a funny little meme, to interact with us as a nonprofit and as a community of chiropractors. And that goes and shows up on the page here. And then we can also link all of this stuff through our website. There's some widgets that we can enable on our website once things get up and rolling, and also to our social media accounts once those start as well.
We have not done much with the social media accounts, but it will absolutely be linking there as well. And it's also a CRM, so we can keep track of who has donated. To date, we're at 35 families have donated, and we're growing, and that's exciting. And we want to make sure we didn't lose anybody. We want to make sure that we're encouraging and utilizing all the wisdom that's being shared with us. Absolutely. Good question. Thank you.
I have a question.
Please.
How far away are you from your $15,000?
Our 50, we've already reached $15,000. We just shy of 15,000. What are we? $250 away from reaching our $15,000. We're looking for $45,000 is what we're looking for the annual budget. And since we're only halfway through the year, we're right on track.
Excellent.
Thanks. All right. Well, thank you guys. If you have any more questions, I would love to answer them either in this setting or on another one. And thanks, guys. We've had a big day today. It's been a lot of fun. We've accomplished a lot. And we have the opportunity to, Phil did interviews with us in between these. And he's already put together that proof of concept. And we're excited to see some more of that. That was an hour of video that he condensed down to 90 seconds, which is pretty good. So, all right. Thank you, guys.
Thank you so much.
Thanks, Randy.
Thank you guys. Have a good one.
Porter.
Thank you.
Thanks, CJ.